Phase 1, we know that the spine's out of alignment. The great thing is you can actually measure it. So if I run a George line straight up, measure the distance, I can communicate to Bob, hey Bob, are you aware you've got a 5 centimetre forward head translation? As Peter pointed out, for every inch, is it?
For every inch is forward, we're factoring the lowest cervical joints.
Okay, so imagine communicating that to Bob, hey, you've got a forward head posture of 5 centimetres, did you know that you've got an 8 times acceleration of spinal degeneration in your spine? No, I didn't. Well, now you know. What do you want to do about it? Well, I should get it fixed, shouldn't I? Right? You can communicate, give the patients the research, show them that this problem will get worse, and allow them to make the choice. Tell me what your understanding of maintenance is. Anyone? Alright Bob, you're on maintenance. You feel good? Yep. We'll see you once a fortnight. Still feeling good? We'll see you once every 3 weeks. Still feeling good? We'll see you once a month. Still feeling good? Once every 6 weeks. Once every 3 months. Once every 6 months. Okay? Is that maintenance? Now the true definition for maintenance to me is wherever that person is functionally or structurally, their next exam should reflect that. That's maintenance. Would you agree with me? Yes. Alright, so if we've got a 72-degree rotation and a 60-degree rotation and they're out of pain and they're happy with the care and they don't want correction, they just want maintenance, then adjust them on a maintenance program. It's their choice, isn't it? Right? Not, well, if you're not seeing me for correction, you can go somewhere else. Because what's going to happen is patients are going to move up and down this model of care based on their current health needs. Not everyone wants spinal correction, agree? Not everyone wants functional correction, agree? Some people just want a quick crack, get me out of pain. The good thing with this, if we go pain relief, we can throw them onto a trial maintenance with pain relief. Now what I do in my office is my maintenance starts off as once a week. I examine patients every 12 adjustments. Right, so your next assessment will be in 3 months' time if you want to go on maintenance. If your tests are showing that you're holding well, all your tests are the same, your pain's under control, then I recommend we stretch you out to once every 2 weeks. Now my good friend Richard gave me trial maintenance. I used to call it maintenance, but I reckon trial maintenance is a better way to measure it, isn't it? Because you're trialling them. You don't know if they're going to maintain once a week adjustments. You don't know if their lifestyle isn't conducive to them lasting weekly or even fortnightly. But I can honestly tell you, functionally they're holding well. I'll keep stretching them out until the lucky band goes ding. And guess what? They start getting pain again, or their functional tests start to falter. Does that make sense for maintenance?
Do you re-x-ray in that?
No, not with maintenance. Okay, maybe 12 months down the track, I might say, hey Bob, look, let's just have a look at your neck because you did have a reverse neck curve, you're feeling pretty good, your tests are holding well, but if this is getting worse, would you want to know about it? Yeah, alright. And some spines don't degenerate, and if they don't degenerate, then great. Alright, that person's able to hold with his lifestyle, everything's working well, but if he's starting to break down and his head's slipping further forward or his spine's translating more, we're starting to see more degeneration, what have you got to go back to him? Here's your first one, Bob. Here's your second one. Based on this is 1 year. In another year, if you continue living the same lifestyle and have the same amount of care, what do you think is going to happen? I'm going to get worse. So what do you want to do about it? We can do correction, or we can trial the maintenance, maybe once a fortnight, because you held well at once a fortnight. Okay? So keep stretching them out as far out as you possibly can. I don't like to go past 1 month. Okay? And as my practice builds, I nip the tail, and then it's 3 weeks, and then it's fortnightly. Okay, I want to look after people that want to be well. I don't really feel like panel beating people that are using chiropractic as a pain reliever or an anti-inflammatory, because that's about the equivalent. So I start off on once a week. Every 12 I reassess them. You must be able to communicate the need for care. Okay, if you can keep showing them that their tests are improving, then you can keep stretching their program of care out. It's easy when you have the test to prove it the clinical necessity for further care. Alright, not based on symptoms. You can say, hey, we're making a 10% or 20% improvement in your rotation. I feel that we can still improve this further. Postural correction. This is the most scientific validated technique in the world today, as field speakers have gone over. It incorporates specific postural adjustments, traction and mirror image exercises. Now, I've got two setups here. I didn't take any photos of the clinic because I had the flu all last week and left this a little bit late. This is an example of someone with a right head shift. You get them to do their exercises at home. Okay, repetitions of this. You adjust them down that way. And we do specific traction, where we're literally stretching them in this position. Now, some chiropractors do traction and mirror image exercises, some don't. I don't care what you do, as long as you are backing it up with changes in x-rays, changes in function, or showing that what you're doing is actually making an improvement. 95% of us have a forward head posture, so pretty much everyone should be doing some sort of traction backwards or receiving adjustments to improve it. Okay, so if we've got a forward head posture, put a strap behind the back, we get it to do exercises. Now they might have a forward head posture and a flexion, so they'll be doing retractions and extensions. They might lay with the head off the back. There's a great thing that I want you guys to write down called a Denner roll. Right, have a look on the internet. Adrian Dennerman, I think his name, has come up with this device called Denner roll. Have anyone come across that? That is fantastic. He's actually making some for kids, or he's cutting them and making them a lot smaller. When you understand about thoracic problems and neck problems, you can use these devices at home. They are really, really simple. Alright, and we get some great results with it. Any questions with the traction or the adjustments? Okay, lifestyle, the missing link. Don't think the adjustments is the be-all and end-all. Okay, adjustments are great for improving spinal motion and correcting postures. Patients need to take responsibility. KLFs show them that their lifestyle is incongruent with health. And there's this great new thing which I haven't even had a chance to unravel, Pete, that Andrew sent me, called the Neuroinfinity, and this is probably where we'll head with our clinic. It's a biofeedback machine that can measure stress response